So let's talk about preoperative weight loss, why we put patients on diet before surgery. One of the main reasons is that operating around the upper part of the stomach, left lobe of the liver is on top of the stomach, and many patients have fatty liver disease, or the liver is very large with fat deposits, and as it enlarged, it decreased the space for us to work around the upper stomach. And in the upper stomach, at the junction of the esophagus, is also the area where we see hiatal hernia. So if we need to repair a hiatal hernia, if we find one that was not known before surgery, we would like to repair it to give a better result for the patient. And so if the liver is extremely large, we might not be able to do this. It also renders the surgery more difficult, as we have to, in sleeve gastrectomy, for example, attach all the small vessels near the top next to the spleen, and it's an area that the distance between the stomach and the spleen is very small, and we need the best space to avoid bleeding. So there are many studies that have been done comparing preoperative diet versus no diet in a randomized fashion. And more recently, there's more evidence showing that for the patient, there is less complication post-op. For example, less risk of bleeding. There is also better operation with better clearance of vessels. And if there is a hiatal hernia, we might be able to do the repair at the same time, or even do a better repair. Also, when we do a sleeve gastrectomy, we want to remove all the top part of the stomach, and if the liver is very large, the surgeon may not be as good of a job in getting all the top part of the stomach. So there are advantages for the patient to do a preoperative diet. We know from CAT scans that are done before and after the diet that the liver will actually shrink and will have less fat deposits in it, and the left side is smaller and we have more space to work. So the duration of the diet is usually proportional to the degree of obesity. So we will do a minimum of about 2 weeks in most patients, but if there is super obesity, we'll add an extra week, so 3 weeks, and if it's super obesity, we will go to 4 weeks of diet. Those diets are usually low calorie, not very low calorie, in the ballpark of 900 kilocalories per day. Often vegetables are added to make it palatable or nice, and of course exercise can be added to that. It's an extra plus. So that is the main reason. It helps the surgeon, it decreases the operative time, and it helps the patient having better surgeries and less complication post-op.